This is Crystal Fenn with MedPage Today here in San Francisco at the ASCO Breast Cancer Symposium, where researchers reported that younger women may be at higher risk after breast-conserving surgery for ductal carcinoma in situ. I spoke with Dr. Iowa Kong of the Odette Cancer Center, who reported the results here.
So in our study, we looked at a population of young women with DCIS who were treated with breast-conserving surgery and radiation. And what we found was younger women, so those under the age of 45 at time of diagnosis, had higher recurrence rates. So they had higher likelihood of developing either DCIS or invasive breast cancer after their treatments. Other studies have looked at it. The strength of our study was really that we looked at a large population, so provincial-wide cohort, so in Ontario, Canada, and so we were able to have large numbers, larger than previously published studies, which were typically single institution or had small numbers of young women, to see if we could confirm the higher recurrence rates. Younger women may be less likely to be screened and have clinically palpable lumps when they present with DCIS. Also, they have a higher likelihood of having a positive family history or having genetic reasons, so BRCA mutations that might put them at higher risk. There's also previously been studies and suggestions that maybe surgeons resect less tissue in younger women because of the concern of cosmesis, and we actually are going to be evaluating that in our cohort to see if that's true. And then finally, there are suggestions that maybe tumor characteristics about biologically the DCIS that younger women get, whether they are higher grade or just are histologically more aggressive disease in older women. And I think this needs further study.
Dr. Kong also cautioned against overinterpreting the results of their study.
This is really preliminary data, so this in no way suggests that young women cannot be treated safely with breast-conserving surgery. I think that we need to further investigate why younger women have higher recurrence rates, and we need to look at other types of treatment. So the use of tamoxifen, which I know is used quite extensively for DCIS in the United States to decrease recurrence rates in young women, and potentially things like boost radiation, so additional radiation that's delivered just to the surgical cavity after whole breast radiation.
So while younger women may have somewhat poorer outcomes than older women in this setting, it may not be a reason to rule out breast-conserving surgery. Here in San Francisco at the ASCO Breast Cancer Symposium, I'm Crystal Fenn, MedPage Today.